In this video, I want to get into more detail about what might really be going on inside your child's body for those children that are suffering with symptoms of ADHD, mood, and behavior imbalances. You might be interested in looking at this video because maybe you've already experienced some of the side effects to medications. Maybe you haven't started medications, but you're looking for what is the most appropriate next steps to take to support your child's wellness in the best way that you know how. And I want to be very clear that I'm not saying there's no place for medications, I'm just saying that they shouldn't be the first option that you choose. Even Hippocrates said, first, do no harm. So what that means is that initially start with what is going to be effective but the least invasive treatment first, and then progress accordingly. So that means you don't have to start right off the bat with heavy medications with the potential of lots of side effects. When I dive into these three pillars with most of the families that I work with and their children, I find that we often are able to find a lot of resolution around their symptoms of mood and behavior and focus without the potential for negative side effects. We take the time to understand the individual underlying root factors for your child. There are several factors that are essential to look at when dealing with ADHD, mood, and behavior. The first pillar we look at is individual biochemistry. And it is essential to start here because this can be a rate-limiting step for everything else. If your child has a biochemical imbalance, they will not be able to access the neurochemistry that they need that governs the way that they think, feel, and act. There are very specific and well-researched biochemical imbalances that affect the ability to make key neurotransmitters. Neurotransmitters such as serotonin, dopamine, norepinephrine, and GABA. These neurotransmitters are fundamental for symptoms related to ADHD and need to be in the right balance. These neurotransmitters are responsible for functions like focus, mood regulation, and attention. These imbalances have been well researched and have been shown to be at the root of many classic imbalances related to ADHD, mood, and behavior. With a research database of over 1.5 million chemical assays showing correlations between these specific biochemical imbalances and the symptoms of ADHD, mood, and behavior dysregulation. The good news is that most of these biochemical imbalances can be treated very effectively with targeted nutritional intervention, and that nutrient therapy is very safe, effective, and low risk for any side effects. The second pillar is diet, nutrition, gut biome, and blood sugar regulation. This is such an important foundation for not just ADHD, behavior, and mood disabilities, but for overall health of your child. All of these factors can potentially have such strong correlations to energy, to mood, to focus. Many of the symptoms we see with ADHD. But not only ADHD, they're also paramount of importance to things like energy production, mitochondrial function, our immune system function, the health of our skin. Just about everything under the sun is dictated by our overall diet and nutrition. And the third pillar is self-regulation. Self-regulation has become such an important topic over the last several years. Essentially what self-regulation is our ability to regulate our autonomic nervous system. And what I mean by that is our autonomic nervous system governs our ability to stay in fight or flight, or rest, regulate, and digest. When children are dealing with ADHD, mood, and behavior instability, they are living primarily in fight or flight. They have a very poor ability to self-regulate. This is such an important piece for parents to understand, because what this means is that your child is not a bad child. They are a stressed child. And when you're stressed, you are not able to respond in the way that we would like them to. They are reacting out of fight or flight and in survival mode. When we work with self-regulation, we work with families. Because it is not just about fixing the child, it's about giving the child the proper support and the tools necessary to help them self-regulate, and it is equally as important, if not even more, for the parent to be able to self-regulate and for the parent to know how to assist their child back into self-regulation. By exploring these three pillars, we often notice dramatic changes in the child's overall well-being and their ability to manage their symptoms of ADHD, mood, and behavior. I'll give you an example. There was a child I saw a couple of years back that really sits in my head. And this child was 11 years old when they came to me. They were diagnosed with anxiety and ADHD, and they had gotten to the point where there was constant conflict at home. They were having a hard time socializing with peers. Any kind of stress, they would be under the table, biting themselves to try and self-regulate. They were really in a bad place. This specific child, one of the things that we checked was the first pillar, and we looked at their biochemistry. And this is why this is such an important piece. One of the markers that we look at should normally fall within a certain reference range. When I ran this child's biochemistry, they were over 10 times higher than what they should be for a normal limit. Now, what this was actually doing was biochemically pushing this child into fight or flight. They were absolutely unable to manage their environment because they were so stuck in fight or flight and survival mode. Once we were able to treat them and get their levels substantially lower again, all of a sudden things started to shift. They started to react a little bit better socially. There was less fighting with their parents. They were able to focus a little bit better with school. Essentially, their life started to shift, and I don't think that that child ever knew what it was like up until that point to feel calm inside their body. If this is an area that you or your family has been struggling with, I offer health coaching globally. If you are interested in booking an appointment and learning more about how to manage these symptoms and get to the root cause, please contact me at www.drjasonloken.com or click on the link below to book an appointment. We do an initial consultation over a video platform so I can fully understand your child's story. From there, we would explore these 3 pillars together. Any labs that may be required, I can often prescribe so that you can get them done within your own local town. Whether you choose to see me or another doctor, please make sure that you download the PDF so that you have all the information necessary. There are always options for your child. You just need to know how to ask the right questions. By being here right now, it shows that you are taking the time to really understand your child's overall health and well-being, and to give them the tools and the support and the strategies necessary so that they can live a fulfilled, healthy, successful life.